Hello and welcome to Pune Times Mirror. In today's episode, we'll explore the world of infertility. Joining us for this insightful conversation is Dr. Mrinmayi Dharmadhikari, who's a senior IVF consultant at the Silver Lining IVF Center. Correct?
Yes, that's right.
So, welcome to the show,
Thank
Dr.
you so
Mrinmayi.
much. Thank you.
It's a pleasure having you with us. So, my first question to you is that is infertility becoming more common among young couples today? If so, what are the key reasons behind this trend?
Yes, so this is a very valid question, first of all. Infertility has become a rising issue, especially among the youth of today. And one of the most important reasons for this is our changing lifestyles, our modern lifestyles. So 1 in 6 couples in India today suffer from infertility.
1 in 6.
Yes, that's right.
That's huge.
It's a huge number. And one of the causes attributing to infertility is the age.
Oh.
So delaying the marriages, delaying the age at which children are born, all of that is rising. And that is why it is contributing to infertility. So if you would ask me the top 3 lifestyle related causes of infertility, I would say unhealthy diet, lack of exercise, stress and addictions. So these form very important
addictions
aspects.
include all those vices which people
Yes.
indulge in, which we'll talk about a
Yes,
little
yes.
later.
Absolutely.
So, how long should couples try to conceive naturally before consulting an infertility or a fertility expert rather?
Correct. So this is something again which a lot of my patients ask that, do we need infertility treatment? So by definition, if a couple who's less than 35 years of age have been trying for a pregnancy with regular unprotected intercourse for a period of 1 year and have still not been able to conceive, then that is the time they need to visit a fertility doctor.
35 is the age.
35 is the less than 35.
Less than 35.
You try for a year. However, if you're more than 35, then the time frame reduces. Then you should try for at least 6 months before stepping into your fertility doctor's hospital.
And get your consultation and testing and all that.
Correct. That's
So,
correct.
so Doc, tell me one thing. This infertility issue among the youth of today, how does this compare with the other countries, developed countries in the world, like let's say the US or Europe?
Correct. So infertility, if you compare it in India versus the US or the so-called first world nations, infertility is a rising issue everywhere.
Everywhere.
Because lifestyles are changing everywhere.
Correct.
Other than lifestyles, causes like infections which can cause infertility. So those reasons are different given the infections which are prevalent in the individual countries.
Right.
For example, tuberculosis is a huge problem in India still.
Okay.
And a lot of women who have had a history of tuberculosis come to us with infertility because of blocked tubes or the lining of the uterus is not growing very well, reduced egg quality. But a common factor in all the nations today is delayed age at which people are getting married, delayed age of childbearing, and that reduces the total fertility potential of the woman. So, we are quite comparable with the first world nations.
So tell me one thing, or tell our viewers rather one thing, that this age group that they come to you for this kind of consultation and treatment, from what age to what age does it range? For men and women, I'm talking, you could probably take it separately.
Yeah, so for women, I have girls as young as 20 to 42, 43 who come to me for treatment of infertility. But then again, this is a very societal issue. Girls, usually in the rural areas, they get married faster.
Correct.
Maybe at 18, 19.
Right.
They try for a year, not happening. The alarm bells start ringing. And then they visit the fertility consultant earlier.
I see.
In the urban populations, it's a little, towards the 30s, 32s when they get married, try for a year, not happening, and then that is when they come to us.
Okay. So these women who come to you, or men also, at the age of 40 or whatever, so are you trying to tell us that, or are you highlighting the fact that they probably got married early, and till the age of 40 or 35 or whatever after that, they still, neither of them have been able to, conceive.
So that is one of the issues. It also depends on acceptability. Or acceptance. If the couple is married at 30 in 2 years, if they've not been able to conceive, but they're just, because of social stigma attached to infertility or with IVF, they're just afraid to approach an IVF center or an infertility center. And they just keep on trying for a longer period of time. And at the age of 40, it hits them that, oh, we should have done this earlier.
So basically hoping against hope.
Correct.
That something will work out,
Yes,
something will work
yes,
out. And then
yes.
finally they reach an age where,
Absolutely.
it's reached,
Yeah.
it's too late.
Hope
Perhaps.
sometimes is not the best thing to have.
Yeah, not the best thing to have. So is this fertility testing primarily for men or for women or for both?
So again, a very valid question. Fertility testing is for both, because infertility, as against popular belief, it's not a woman issue.
It's not a women issue.
It's not a woman-based issue. It is a couple issue.
Okay.
So I would always insist that my patients come in as a couple. It is
Okay.
very important to get the male partner tested as well, because 40% of infertility is contributed by males, in fact.
40%.
40%. So if they are tested in time, the treatment is quite simple sometimes. And
Okay.
it is probably a game changer for that couple. They would probably conceive faster if the cause of infertility is diagnosed in time.
So when you say cause of infertility, what could be the major, impact or concern why they're not conceiving? And how is it going to be treated? That's important.
Yeah. So let me just divide this into male and female. So if we talk about the females, there could be concerns about egg quality.
Egg quality.
Egg quality. So with age, the egg quality starts falling. There
Okay.
could be concerns about the egg growing and rupturing in time. That is ovulation.
Ovulation.
Sometimes this ovulation does not take place in a regular manner in women with polycystic ovarian syndrome or PCOS, as you may have
Yeah,
heard.
okay.
And that is one of the very common causes of infertility.
Okay.
But then again, the treatment for PCOS is very simple. There are certain medications which we give to grow the eggs. We monitor that the eggs are growing well in time, they are rupturing in time, and sometimes these patients conceive even naturally. On the other hand, if the eggs are less in number,
Okay.
usually which happens with advanced age,
Okay.
or if the quality has reduced, then that is a tricky situation. Then we are running on a biological clock.
Oh.
Because women have a certain number of eggs which they have to, it's a finite number of eggs.
Okay.
And we need to use it till the age of 50.
Till the age of 50.
So the faster you conceive, the better the quality of the egg and the faster it's going to happen. So this is where the concept of egg freezing also comes into the picture.
Egg freezing.
Egg freezing, where a lot of young girls who have not yet got married or they have other priorities, they're not yet ready to settle or have children. Egg freezing, I think, is a very smart choice for them, where they freeze their eggs for use later on, whenever they feel they're physically, mentally, financially ready for having a pregnancy. And we hear a lot of celebrities doing this as well. But
Absolutely.
I would say that this is not just for celebrities, it's for any woman who wants to have more control over her life.
And how long can the egg or the eggs, I'm not very sure about that, how long can it be frozen for? I mean, is there a duration involved in it?
So these eggs are frozen at minus 200 degrees Celsius. And technically speaking, they can be frozen forever.
Frozen forever?
Yes, but there is a law governing it, of course. Usually we are allowed to freeze it for 10 years. But basically in 10 years' time, you either are going to use them or you're going to conceive naturally.
Absolutely, absolutely. So, so let's say, God forbid, if the woman's eggs are frozen and a mishap takes place or a misfortune takes place and the lady passes away,
Okay.
can those eggs be used to help some other lady conceive?
No, so
Who's infertile?
No, so legally we cannot use someone's eggs for helping someone else.
Okay.
And previously there was no law governing all this, but now
Okay.
we have very strict regulations which forbids this
Forbid.
kind
So,
of practice.
okay,
Correct.
so it's not authorized by law
It's
and you all cannot do
We
it.
cannot do it.
Okay. So in today's lifestyle, everything is very fast paced. There's a constant stress, which is, I think, a very big factor. And stress is probably something which people don't realize that they're stressed, but they actually are.
Yeah.
Long working hours, very long working
Yes.
hours, a lot of targets and stuff like that. So how does this actually impact fertility in both the men and the women?
So stress in itself causes a lot of hormonal imbalance both in men and women.
And women.
And stress not only does it affect the body, but it also affects your sleep pattern,
Okay.
which is very important for your body to recuperate
Yes.
throughout the night. So, having slept well and getting up in the morning feeling fresh, it's a sign of good health.
Absolutely.
But then
Absolutely.
again, we cannot ask the patient, quit your job.
Exactly.
Right? You cannot quit your job, but of course, you can do certain things to de-stress.
Correct.
Like following a good diet, avoiding very high salt and sugar content, caffeine, alcohol. All these are, we feel that they are stress busters, but they in fact increase the amount of stress which your body is going through
I
and
see.
can affect infertility too.
Yeah. Perhaps consuming a lot of caffeine, they probably think that
Yes.
it gives you, it
Energy.
boosts your energy, but I guess it works in the reverse way.
Yes.
Okay. So habits like smoking, vaping, I hope I pronounced it right, or occasional weekend drinking. Does this have like an impact on your on a couple's reproductive health?
Yes. So, smoking, vaping, especially binge drinking, can affect the egg quality and the sperm quality and can overall reduce your fertility potential.
That is if the woman is drinking.
Both of them.
Both of them.
Both of them.
Both of
Because the egg quality, the sperm quality, basically what all of these things do is it causes an oxidative stress in the body,
Okay.
which does not let the egg reach its maximum potential of fertility.
Right.
Same with the sperms. So I do have a lot of my IT population who comes to me who says, no, we've been working for 5 days and we are so stressed out. Weekends is the time we relax. So we need that one glass of whiskey, or we need that one smoke, or we need to vape on the weekends.
Right.
Both girls and the men. So I usually tell them that you are not de-stressing. You are in fact adding to the stress which you have gone through for the whole week.
Perhaps accelerating it.
Exactly. And this leads to infertility, and infertility in itself is a stress for the couple.
Absolutely.
Family pressure, societal pressure, why aren't you conceiving? It's been 5 years. All of that, because we are still living in the Indian diaspora where infertility is still looked down upon.
And I guess fingers get pointed at the girl, and the girl's family pointed at the boys.
Yes.
So both get
It's a
blamed.
blame game.
It's a blame
It's
game.
a blame game. But the faster the couples understand that it is not a blame game, the faster they conceive.
So tell our viewers another thing. Married couple working, and a married couple in which one partner is working and the other one is not working. So in both these cases, how does infertility, come up, and is it more prominent in both of them working and one of them not working?
So to answer your question, I would say that work has nothing to do with infertility. It is how you manage the work.
How do you manage?
And how you manage your work-life balance.
Right.
That is what is going to have an effect on your fertility. So I do have a lot of women who quit their jobs because I'm undergoing infertility treatment. But the effect that this sometimes has on some women is that I sit at home and I'm just thinking the same things again. When will I get pregnant? Will I ever get pregnant? Will I need an IVF cycle or not? And then we have the internet to add to the stress, where there is a lot of information, half-cooked information
Half-cooked
sometimes,
information. I was just going to
with
say.
easy access.
I know. I
So
can
this
imagine.
again causes a lot of stress. So sometimes they say, let me just get back to work. My mind is distracted.
Right.
I meet other people. I talk about other things, and that helps me.
Right. And also, if the couple is, let's say they decide not to, how long do the medicines take? Suppose they come in for treatment. So how long will those medicines take to affect them and probably get them fertile again?
So this depends upon the cause of infertility.
Okay.
Causes of infertility are varied.
Correct.
In the couple. So unless we find out what is the cause of the infertility, we cannot say which medicines to prescribe.
Prescribed for them.
For example, male infertility with a very low sperm count. I did have a couple come up to me saying that we have a very low sperm count. We were told IVF and we don't want to go for it.
We don't want to go for
We
it.
don't want to go for it. Looking at his sperm count, the most logical answer would have been IVF, but what I saw that the male partner was not evaluated as to why does he have a low sperm count.
Absolutely.
So we did a few hormonal tests. We also found out that he did smoke a lot. He reduced his smoking very consciously. He put in a lot of effort for it. It is very difficult to suddenly quit.
Absolutely.
Hormonal tests were done. His hormones were on the lower side. So what we did was we started him on some simple tablets to improve his hormonal profile.
Oh, I see.
For 3 months. The couple came back to me after 1.5 months with a natural pregnancy.
Amazing.
So,
Amazing.
I mean,
Amazing.
finding out the root cause and then giving
The
treatment
proper
which is
treatment.
appropriate is how an infertility treatment works. It's not IVF is for everyone.
Right.
Not
right.
at all. But there are some patients who do need IVF.
Oh, I see. And when couples come to you for treatment, to get their fertility back, what percentage of the treatment actually works?
What percentage of the treatment? Again, it depends on the cause. For example,
Depend
in
on
a
the cause.
PCOS patient whose egg does not grow every month, and maybe her weight is on the higher side. If she actually reduces the weight, gets into a good lifestyle with exercise, diet, and if we give her some simple medications to grow the egg, almost 80% of those women are going to conceive naturally.
80% of them.
80%.
That's huge.
Because we know the cause and we are treating the cause.
Absolutely. It's a tech world. Everybody uses
Yes.
different techs, laptops,
Yeah.
earphones, mobile phones. So do these techs actually affect the male and the female fertility? Because even females are using it. Ladies are using that.
Yes.
Yeah.
So, in the modern world that we're living in, it does have its own advantages, but yes, the drawbacks include a decrease in the fertility. So, for example, keeping the laptop on the lap or mobile phones in the pocket, it does emit certain radiations, it does increase the heating of the
Correct.
body. So, that can affect the sperm quality. That having said, screen time, it affects everything. I mean, if you're working the whole day on your screen, we log in at this time, we log out at this time, but after that, if you're still stuck to the screen, then that's on you.
Yeah.
Then you can't say it is my job.
Absolutely. So once you're finished up with the laptops, you go back home and all, and you're still on the phone.
You're still on the phone or you're stuck to the screen, and that affects your sleep quality as well.
Sleep quality.
Because then I have patients who come to me saying, I don't fall asleep at night. I was like, then what do? I'm just scrolling my reels.
So
You're never going to fall asleep at this
You're
rate.
never going to fall asleep. Yeah, I know. There have been people who've told me, that, we don't get sleep. So I said, what do you do? And they tell me the same thing. We either try to read a book or we go on the phone and we are browsing and stuff. So that affects fertility too
It does.
in the long
It
run.
does.
Okay.
It does.
So this in vitro fertilization, IVF, is this the only option for those who are facing these infertility problems? And is it really as complicated or costly as it seems?
So that's one of the biggest myths which stops patients from seeking treatment for infertility, that infertility is equal to IVF, which is absolutely wrong. Infertility treatment means finding out the cause of infertility. Sometimes simple measures like weight loss, exercise, avoiding addictions is what can get you to become pregnant. IVF is required for a very handful of people with infertility. For example, those who have both the tubes are blocked and even an operation has failed to kind of reunite the tubes. Or those who are at the cusp of their age, in their 40s, where the egg quality is so low that a natural pregnancy might take a longer time.
Longer period.
And maybe then you've lost out on that time. Or if the sperm count is so low, no amount of medicines are helping, then IVF really can work miracles.
I see.
So there are a certain handful of people in whom IVF is very important, and that is perhaps the only way out. But otherwise, infertility treatment does not mean IVF. There is a vast array of tests and treatments which we offer the patient before going in for IVF.
And how old is IVF treatment? When has it originated and come into being?
So I recently saw a movie on Netflix. And it's called Joy. And it kind of is like a movie which is produced on the first IVF baby, who was Louis Brown, 1981. So it was based in 1981. The movie is very recent. And that was the time where, the technology was not so advanced.
Absolutely.
But still they created this magic.
Imagine.
And that was the time that infertility suddenly then increased in leaps and bounds. And here we are, where today with IVF, we can even check an embryo which is formed in the lab to see if there are any genetic abnormalities, so that the baby which forms is not abnormal.
Right.
So there are certain couples who have recurrent miscarriages, 8 miscarriages, 9 miscarriages, and sometimes it is a genetic problem.
Oh.
So every time the woman gets pregnant, she's like, I'm scared. What if I miscarry again?
My God.
So in this situation, IVF can really help, where we make the embryo, we take the woman's egg, we take the husband's sperm, we fertilize it in the laboratory, in the IVF lab, we form the embryo, and we are actually able to test these embryos genetically and transfer only the normal embryo.
My
and
God.
This kind of treatment has really worked wonders for a lot of couples.
So this miscarriages and not being able to conceive, these are probably related but two different things, because you
Correct.
can get pregnant and have a miscarriage, or you don't get pregnant at all. So how would you relate these two?
So miscarriages have a different set of causes. Sometimes every time the embryo is being formed in the body, it is an abnormal embryo. So what the body does, what nature has done, is that either that embryo won't implant, in which the patient will come to me for infertility,
right,
or it implants, but then nature says no, this might result in an abnormal baby.
My God.
So let's just make sure that it doesn't grow.
It doesn't grow.
So in this situation, they will come with recurrent miscarriages.
Right.
So sometimes the cause can be, under the same umbrella, but infertility in itself means that the patient is not able to conceive at all. And miscarriages, they are able to conceive, but they're not able to carry the pregnancy forward.
So menopause, which takes place. Of course, it happens in women. So till what age can a woman actually conceive, and till what age can a man actually also help in having his partner conceive? What age would that fall under?
So if you see like a general age group, from 20 to 32 is the age group where pregnancy usually takes place quite well. After that, the issues may start.
Right.
But some patients, even after 40, they say accidental pregnancy ho gaya. Even after 40.
After 40?
Yeah. That is rare. Yeah. So we cannot, use that as an example that,
Correct.
but she conceived after 40 naturally.
So it's possible.
No. So that is an exception.
Right.
But the younger you are, as a thumb rule, the younger you are, the better the eggs, the better the sperms, the better the hormones, the better your body, and the better the pregnancy.
So another thing, if a woman conceives late, like say after 32 or 35, or in some cases 40, and a baby is born, does this also, it's a little different from what we are discussing, infertility and stuff. Can this cause breast cancer? Because, the body is going through a change very late in life, which should have been done earlier. So just a quick thing.
So not particularly breast cancer, but as age advances, complications during pregnancy increases.
Oh, I see.
Like the risk of increased blood pressure, the risk of diabetes, the risk of early deliveries, the risk of miscarriages.
My God.
So this increases with age, because just like all our other body parts age, so does the uterus.
Correct.
So the body is not able to support the pregnancy as well as it would have at 20-25.
Because it's not as healthy, I suppose.
Exactly.
Correct. So this polycystic ovary syndrome, PCOS, does this lead to infertility, and what steps can be taken to manage it effectively?
Yes, so PCOS is a very common problem. Mostly it is a lifestyle related disease, where the egg, which usually should grow every month and rupture, does not happen.
Okay.
So girls typically present with irregular periods, where the periods are delayed or missed periods. Periods are coming after 2 months, 3 months.
Okay.
And because the cause is a hormonal imbalance, yes, it can lead to infertility, because the egg is not growing.
Okay.
But the treatment, again, as I said, is very simple. A few lifestyle changes and consulting your fertility doctor in time.
In time, of course. So what's the one common myth about infertility that you would like people to know?
There are a number of myths about infertility, but one which I would like to highlight today is that people think that infertility is a very female problem.
Correct.
It's a couple problem. So whenever you're going to your fertility consultant for an appointment, make sure your husband is coming with you.
Absolutely.
Because the faster both of you are evaluated, the faster we can find out the cause.
Actual cause.
And this can be an absolute game changer for you.
Yeah, I know. So if you had to tell the viewers, what are the exact things that they're supposed to do to avoid infertility? Lifestyle habits, what age you should, conceive, and I guess, so that people know exactly, and when should they get the test done or go for the consultancy instead of dealing it.
Okay. So to avoid infertility, certain lifestyle changes, a healthy, balanced diet, avoid crash diets.
Okay.
Good amount of exercise, at least 30 minutes a day. I mean, I'm sure each one of us can take out 30 minutes a day for your body.
Absolutely.
Stress. So again, you don't need to quit your job, but to de-stress, have a hobby.
Okay.
Or go out for a run.
Okay.
Sleep well.
Okay.
So these are certain things which will help you to de-stress. Meditation, yoga, all of these things also help in de-stressing.
Right.
Avoiding addictions as far as possible.
Smoking, drinking,
vaping, all the whole basket.
Okay. What about food? Non-veg food. A lot of non-veg food. Does it also affect?
So non-veg food is basically protein.
Proteins.
Anything in moderation is not going to have ill effects on your body.
Right.
Anything in excess will. And the preparation of your food is more important. If it is very oily, salty, if you want to have your dessert after every meal, if you want to tuck into bed after every meal, it's going to have an adverse effect on your body.
So if a woman is pregnant, what kind of diet should that lady follow so that it doesn't affect the conceiving factor and doesn't lead to a miscarriage?
So diet for a pregnant lady should be high in protein.
High in protein.
So all the sprouts, the legumes, egg whites. Or even chicken in moderation, dry fruits, and a lot of hydration.
Hydration. Very important.
That is very important. Food which does not have excess salt and excess sugar. So avoiding salt, on top of your meals, or in any salad, it's a pinch of salt.
Yeah, pinch of salt. That extra salt, which is not
cooked. Which is not needed.
Yeah, which is not cooked.
And basically the body will tell you during pregnancy, especially in the first 3 months, certain women have cravings. Certain women don't want to have certain types of food.
Right.
So you need to listen to your body. Your body will tell you that this is good for you and your baby.
Right.
So there is no one diet fits all.
Absolutely.
So you need to listen to your body.
Right.
So usually I don't give a diet chart in the first 3 months because the lady is having a lot of nausea, vomiting. If I give a diet chart that you need to eat this today, she'll be like, I cannot, and she'll stress out.
Yeah, she'll stress out.
Yeah. So listening to your body is key at all stages of pregnancy.
Wow, great. So Dr. Mrinmayi, it was a pleasure having you with us.
Likewise.
And speaking to Pune Mirror and, telling our viewers about, what they should do and what they shouldn't do when they should get their consultation done. Thank you so much for coming and talking to us.
Thank you so much for having me. Thank you.
Thank you, doctor.